Welcome back. Between juggling work, relationships, and life, some of us forget oftentimes to take care of ourselves, and that could lead to burnout, among a lot of other things. In today's Eye on Health, Dr. Keshav Grover joins us to talk about the importance of taking care of your well-being and steps that you can take right now to stay healthy. Dr. Grover, thanks so much for joining us.
No, thank you for having me.
You have a very interesting practice, so tell us a little bit about it.
Sure. So we are Grover Health and Aesthetics. We're a functional and integrative medicine practice, and we also practice aesthetics. So our premise is to figure out what are the goals that people have for their well-being and what may be the underlying root causes of their health conditions, and figuring out what is a custom tailor-made plan that uses traditional approaches as well as lifestyle approaches to create a tailor-made package for them that helps them get to their goals.
When people talk about or think about self-care, sometimes it can be little things like going to get your nails done or taking a walk outside. Is self-care more than that?
You know, I definitely would say it is, because, it's just like the good old announcement on the plane that says, when, if we lose cabin pressure, to put the oxygen mask on yourself before helping somebody else. It's just like that. It's an investment in our well-being. And to be honest, what's the most important asset we have is ourselves. So the more investment we put into ourselves, whether that's internally with a wellness practice or a mindfulness practice, or you're getting your hair and nails done because that's what makes you feel better, these are all self-care, and that's something that we do in our practice.
I know not everybody's the same, so it might be different patient to patient, but how do you go about creating a personalized program for someone?
Sure. So a part of our intake process that's starkly unique from a traditional medical practice is our consultations are 60 to 90 minutes. So we're really getting to know our patients. We're getting to know all the nitty-gritty details, what you like to eat, what you don't like to eat, how many times a day are you pooping, for example.
Oh, goodness.
Exactly. And how are you sleeping at nighttime? Are you waking up in the middle of the night? Are you having to go to the bathroom? What's your day life? Like, what's in the day, a day in the life of you, And now I'm getting a little taste of what it is like to be a news anchor by being behind the scenes for a couple of minutes.
So you saw a lot of chaos.
Exactly. So that's what we do. We want to know what's it like to be a fly on the wall in your life so that we understand what is going to be appropriate for you to do every day and what may be an inappropriate expectation of us to have for you to do to reach your goals. Mm-hmm. So we're really sitting down, distilling down, okay, what are the issues going on? What are your goals? How do we tackle the issues? How do we create a plan to get to your goals with our team? And how do we keep you accountable through that process?
What are some of the things that you think contribute to people not taking the appropriate level of self-care?
So I think a lot of it is just sitting down and saying, okay, what's important to me? And figuring out how does that implicate into our daily life? Like, what am I doing today that's going to help me be at, let's say you're a parent, at your child's wedding? What's that going to be to get, like, let's say you want to be 70, 80, 90 years old and rolling around with your grandchildren or great-grandchildren, or traveling, or playing pickleball, the new sport everybody's talking about. How do you put the steps into play to get to that point?
Right.
Or if you are somebody that says, hey, I poop every 3 days and I need help, or I have an inflammatory condition, we're going to help you work through those steps to get to those goals and to tackle the current issues.
Before we go, what is the best way for people to reach you?
Sure. So you can visit drkeshavgrover.com. You can also visit or call us 248-403-8388, and our staff would love to help you out. Yeah.
All right. Dr. Grover, thank you so much for your time. That
Absolutely.
all sounds very good.
Thank you. Appreciate it.